Hey Dr. Bears, how are you doing today? I'm doing pretty well myself, Michael. How are you doing? I'm doing pretty good, thanks for asking. Hey, have you noticed that we look a lot alike, except you don't have a hat on and you have a doctor's coat on? Yeah, we do, except this isn't a lab coat. This is actually a White Sox jersey, but I thought it would work. But Michael, we need to talk. Your type 2 diabetes just really isn't being controlled. So, we've tried a lot of options, but I've decided to put you on Novolog. Novolog? And what is that? It's an insulin pen I rarely use for my type 2 diabetes patients. How it works is that you'll be taking an injection before every meal, depending on the meal itself. Well, that sounds pretty easy. Fortunately, it's not. You have to learn how much insulin to give yourself per meal, and it could really vary depending on person. I want to send you to a dietitian who can train you and on how much to give yourself per meal. Too little, and there might not be an effect, but too much, unfortunately, there would be the possibility for seizures and even death. Oh, wow. So, what should I do? You'll have to measure yourself for current blood sugar. For example, if it's 80, 100, or 400, you have to know how much to give yourself per meal. And that could really depend on the meal you're about to eat. So if it's like a large carb heavy meal that you're going to be having, that could really, really differ compared to a small lunch, let's say. Shoot, that sounds really complicated. It is, but it's the last choice we have. Novolog will help you through every meal, but it's not supposed to help you throughout the day. So I'm going to still keep you on an oral medication for that. I'm going to guess there's side effects. Yes, there are. There's about two classifications of side effects depending on age, but you're a younger guy, so I'm not going to worry about that. But while on the medication, you may feel a sudden surge of adrenaline. This would be due to too much insulin and a drop in blood sugar. Your body will try and help itself out and will release adrenaline to help the liver, which won't do that much. But that adrenaline will still be there. So you'll feel a spike in blood in your heart rate, and you'll start getting really shaky with a lot of energy. If you don't treat it, this could eventually lead to nausea, and unfortunately, you could go so far as to unconsciousness. So you really need to watch out. Worst case is that it could almost lead to seizures. So you really need to be careful with this medication. Shoot, that's really intense, but thank you for laying it on me, Dr. B. I really appreciate it. No problem, Michael. I'm happy I can help.